Welcome to the Learn at Work webinar series hosted by Work, a journal of prevention, assessment, and rehabilitation published by iOS Press. I'm Karen Jacobs. I'm the founding editor of Work, and I'll be moderating today's webinar. It's a really special webinar, and I know you're going to thoroughly enjoy it, so I'm going to turn it over now to Daniel. Daniel, welcome.
Hi, Karen. Thank you so much. I appreciate the opportunity to speak about this. Just a brief introduction. My name is Daniel Rortvedt. I'm an assistant professor in the Master of Occupational Therapy program at Elmhurst College, just outside of Chicago, Illinois. I also own and operate an assistive technology consulting business. The content today, it's based on an article that was co-authored by myself and Dr. Jacobs. So grateful to Karen for her mentorship and guidance. And the majority of the research that we'll be discussing today is based on primary data collected at Boston University as part of the completion of my post-professional doctorate in occupational therapy. I'd also like to acknowledge pioneers really in the field who have explored the use of telehealth, providing some of the foundation for the work that I will describe today. Some of those are Dr. Jacobs, Dr. Jana Kaysen, Dr. Melanie Chris, among many others. So our focus today is on the use of telehealth as a component of school-based occupational therapy practice. We titled the article Designing a User Experience because we're really interested in gathering stakeholder feedback and determining how and whether telehealth could be useful in this form of service delivery. My interest in telehealth started several years ago, and it was almost a defensive reaction to this quote-unquote new way of delivering services. At the time, I was an occupational therapist in a school district, and I was operating in the traditional brick and mortar schools. I wanted to understand what telehealth was. I wanted to look at its pros and cons. And I did that throughout the duration of my post-professional doctorate. Since that time, it's really been a telehealth journey that has helped me see the unique promise of this form of therapy. You may be viewing today just because of a shared interest in telehealth. This is undoubtedly a hot topic right now, not just within occupational therapy, but within several of the health professions. My focus today will be on the use of telehealth in occupational therapy, or abbreviated as OT practice, specifically in a school-based occupational therapy setting. Some of those listening may be OT practitioners. However, for those of you unfamiliar with the field, I'd like just to provide a brief orientation to occupational therapy as described by the American Occupational Therapy Association. So occupational therapy, or OT practitioners, enable people of all ages to live life to its fullest by helping them promote health and prevent or live better with injury, illness, or disability. So quite a broad definition. As occupational therapists, sometimes our scope is quite broad, but as we move through today, I'll give you a little bit more information about how school-based therapists operate. OTs can practice in a variety of settings, including hospitals, skilled nursing facilities, private pediatric clinics, sensory integration clinics, for example, higher education, several other emerging practice areas. Right now, occupational therapists are becoming more integrated in primary care physician settings, which is a very interesting emerging practice area, as well as school systems, which again will be our focus today. Throughout the presentation, you may hear me refer to OT practitioners, and what I mean by that are occupational therapists, registered occupational therapists, and then also COTAs, or certified occupational therapy assistants. In several school systems, these providers work in close concert with one another. So let's take our focus to school-based OTs. In a school setting, OTs support students with activities that are related to their academic and their functional performance. So if you think about a traditional public school, private school environment, skills such as handwriting and typing, some of those academic skills, also some functional skills like washing hands, zipping a jacket to go out to the playground for recess, learning to organize one's thoughts and materials to be the best learner one can be, among other tasks. So these are in some of the domains of what school-based occupational therapists do. And typically in the quote-unquote traditional school-based arrangement, a student with an individualized education program, or IEP, receives either direct or consultative OT services. This might be in a general education classroom environment with peers. It might be in a specialized or therapeutic environment, such as a special education classroom or a therapy gym. And in this arrangement, students receive the services they need. OTs practice in brick and mortar buildings, all is well. However, there are certain sort of unique situations that might warrant a different approach, where that traditional service delivery model doesn't work for whatever reason. Looking at some of the background to sort of this problem, this complex problem, a shortage of occupational therapists is described nationwide here in the United States. And in the school environment specifically, classroom teachers and therapists often find it difficult to collaborate in a close fashion. And this can be due to a variety of factors. Teachers have busy schedules, school-based occupational therapists have very busy schedules. They might be potentially in multiple therapy locations, different school buildings, for example. I'd like to kind of expand on this, and what we're going to do is describe some specific hypothetical. Some of these are based on real scenarios, and some of these are actually based on some of the data that we collected, where the traditional brick and mortar school-based therapy design might not be the best option to enable optimal student performance, which is really what we're looking for as school-based OTs. And we'll go into some more details on some of these examples when we examine the results of this study that's published in Work. So let's envision in our first example, an elementary school age student with a fragile medical condition. And this student at this moment in time is not in the brick and mortar school. They're receiving academic services at home under what are called homebound services. So the student remains a student at the school in title. However, all the services are delivered perhaps by an academic tutor in the home environment. According to the Individualized Education Program, or IEP, for this student is entitled to 120 minutes of school-based OT services per month. So again, the student is in the home environment. The school-based OT may be in the school environment. We'll expand on some of these examples a bit later on. In our second example, and I can speak from personal experience on this one, having been a school-based OT, a school district OT travels between 5 different school buildings in a large geographical area throughout the week, in addition to supervising a COTA. So this individual may likely spend a lot of time traveling between school buildings, perhaps multiple times per day, in order to attend meetings, in order to see students, in order to collaborate with other professionals. And then in our third and final example here, a school-based OT and a classroom teacher need to meet face-to-face to discuss complex issues going on with a student. It's an issue that a phone call just won't do, exchanging some emails just won't do. The teacher and the therapist really need that real-time face-to-face interaction in order to sort out what's going on, in order to, read body language during this interaction. However, the teacher's planned time, the only time the teacher would be available to speak, occurs during a time of day when the OT is physically in a different school building. So 3 sort of unique therapy situations that do happen. They do come up. There are many more of these types of scenarios. And my question is, how are school-based teams to approach these and other complex service delivery problems in school-based therapy environments? So this brings us to a discussion of the definition of telehealth, sort of one proposed solution to some of the aforementioned issues. Telehealth, defined very broadly, is described as the delivery of healthcare services when the client and the provider are in separate locations. This is the definition from the World Federation of Occupational Therapists. When we talk about telehealth, we often are thinking about sessions facilitated by the use of video conferencing technology. So live, face-to-face, webcam, video conferencing sessions. However, that is not the only way of delivering a telehealth service. Telehealth services can be asynchronous, synchronous, they can be web camera based, they can be audio based, as we are today. So lots of variety in mediums and platforms for telehealth. A lot of what I discussed today is based on this sort of live video conferencing telehealth approach. The use of telehealth is supported within the health professions. Here are 2 examples from the literature, which both found no significant differences in outcome of service delivery, whether the service was provided in person or via telehealth. One's an ergonomics assessment that was delivered via telehealth. The other is therapist training protocol, and again, found no significant difference in outcome, regardless of the service delivery method. Within pediatric occupational therapy practice, there are a variety of mechanisms via which telehealth is proposed to work, including, and some of these are very intuitive, including allowing and speeding up access to services. If a child is on a wait list for brick and mortar OT services, for example, a therapist using telehealth may be able to provide interim services and supports until the child is able to be seen in person or in that environment. Telehealth has also been found to increase collaboration and carryover of treatment strategies. I think this is a really interesting point from the literature. As occupational therapists, we often suggest strategies to parents and families, ways that we can change the daily routine in that family's life to become more therapeutic for whatever reason. For example, an OT might embed a hand strengthening activity into a child's afternoon play routine in order to get mass practice with that sort of activity. And some of these outcomes might be better achieved in the real environment, the natural environment, when the therapist is able to see and have the child and the family use natural resources during the session. Some of those pieces can be better achieved within a telehealth session than they might be in a therapeutic environment such as a clinic. Again, in certain scenarios, and we'll talk about qualifiers for all these and how it's definitely a balance. So for these reasons, other reasons, the use of telehealth has been found overall to improve client and therapist satisfaction, and a number of articles cite this outcome as far as increased satisfaction. I left this, the fourth bullet point on this slide. It's a little bit of an aside, but it's an important point to consider while we're discussing adoption of telehealth, prevalence of the use of telehealth. Reimbursement for occupational therapy services delivered via telehealth at this moment in time is quite variable here in the United States. In some states, the use of telehealth is allowable by state licensure laws, but not reimbursed, for example. In some cases, it's the opposite. So therapists need to be very mindful of these considerations. There are excellent resources out there on reimbursement. The American Occupational Therapy Association has excellent resources on the topic. They recently published an updated position paper on the use of telehealth. So lots of resources out there if you're interested in this topic. Okay, so bringing the focus to this project, in the literature, we know something about how telehealth might work. We know that in certain scenarios, it might be quite helpful, but what do therapists and other potential telehealth users think about it? How do they feel about it? If we're going to propose the use of a new technology, it's important to know what users know and think, because as described in this article, clinician satisfaction is critical to the widespread acceptance and use of telehealth. So what do potential telehealth users know and think? In the literature, we were able to locate qualitative perspectives from school-based speech and language pathologists, but studies relative to school-based OT were quite limited. So to explore this, I wanted to understand the perspective of potential telehealth users. Who are these individuals, these communities, these organizations who could potentially use telehealth within their school districts? What do they think? What do they need? What do they know? Just understanding their perspectives in order to help find that just right match between the person and the technology. So this slide contains examples of some of those school-based telehealth potential users, and it's not just occupational therapy practitioners. It's a team environment in the school district. So we might have special ed administrators, we might have therapy supervisors. Of course, someone will need to be involved in the technology infrastructure, so those district technology staff and others are important stakeholders in this project. I won't dwell on this as far as research questions, but I do want to highlight this word augment, and that was purposeful. So one of the research questions that guided the project was, what are the potential uses of a telehealth service delivery model to augment school-based OT practice? A little bit later on, we'll talk about literature suggesting that telehealth doesn't necessarily need to replace traditional service delivery, but how could it enhance it? How could it augment what's currently existing? And then what are the perceived barriers and supports to the implementation of telehealth? And perceived is perceived because these stakeholders currently did not use telehealth. A list of program objectives is included here. This was a pilot project, so really one of the main goals was just increasing awareness of telehealth among school-based practitioners, exploring whether or not this was a therapeutic medium that might work. Moving into methods. To examine these stakeholder perspectives, we delivered an anonymous online survey through Qualtrics to approximately 67 individuals across 3 school districts and a suburban area of the Midwestern United States. Obtained IRB approval through Boston University for this. Total of 67 participants were invited. Project borrowed some theoretical foundations, primarily from adult learning theory, diffusion of innovations theory, and also the trans-theoretical or stages of change model. On the right, you can see within the project, within the program, which I'll describe a little bit further, how each of these theories was reflective. So an evidence-based, theoretically bounded sort of project and activity. This slide highlights the 3 phases of the overall project, including a pre-program survey, online educational, telehealth program, and a post-program survey. Today, our discussion is going to focus on the first part here, the results of the pre-program survey. I'll also briefly go into implications for telehealth training and briefly discuss the online educational program. But really our focus and the focus of the article is on those participant stakeholder perceptions of telehealth. So let's move in and take a look at the survey items to give you a feel for what we were looking for from participants. The following few slides are example screenshots of some of the survey items. Participants were asked to describe their roles within their school districts. They were asked to describe some of the characteristics of their school districts, so whether they were in a public school setting, private school setting, charter school, online school, and some of the population characteristics of their districts. Participants were also asked whether their districts currently had a policy on the use of telehealth. Again, this was in participatory action research study, so we wanted to look at how can we increase awareness of telehealth by asking these questions. So part of that was including a definition of telehealth. So for individuals who weren't sure what it was, haven't heard of it, they have that bit of background before they're going to tell us more about their perspectives. Participants were also asked to report on the likelihood of adoption of telehealth within their context and to share their perspectives on benefits and barriers to the use of telehealth. And these benefits and barriers questions were phrased in an open-ended format, which allowed participants to share their thoughts, questions, ideas in that sort of unbounded format. We'll go into the results and what they thought in just a moment here. Moving into results, and again, our focus today is just on those pre-program survey results, baseline knowledge, attitudes toward telehealth. We had an approximately 40% response rate, with the majority of respondents being occupational therapists. Special education administrators made up a portion, about 23% of respondents. We had about 11% certified occupational therapy assistants respond, and a few other stakeholders in there as well. We had at least some representation from each of the categories. Participants' open-ended responses were analyzed, coded, and organized into categories based on identified themes. And for the benefits of telehealth, as reported by participants, these themes emerged as telehealth, allowing for improved logistics, support for classroom observations, what's called MTSS, or multi-tiered system of support services, for students who don't necessarily have an IEP, but may need some OT observation, potential strategies here and there in the classroom environment. Another theme that came out was support for homebound students. Again, this goes back to our hypothetical example from earlier, telehealth being a viable service delivery model for a student who is homebound and perhaps receives occupational therapy services on their IEP. Participants also reported collaboration, consultation, and supervision being enhanced by the use of telehealth. In that OT-COTA relationship, Typically, the OTs provide supervision to COTAs, also to classroom assistants, and that supervision might be able to be conducted via telehealth. There were some other perceived benefits as well in this example. Staffing, OT shortages and staffing might be a perceived benefit here. Might be able to locate a therapist practicing via telehealth to deliver that services. As far as barriers, participants reported potential difficulties inherent in the use of technology and the use of telehealth, including, again, logistical factors. So ensuring that the student is supervised by an adult while participating in the therapeutic session. We take some of these things for granted. These are excellent points. If we're going to have an occupational therapy session be virtual, the therapist and the client are in separate locations, how will we ensure that the student arrives at the computer with the webcam, gets the technology set up, stays in that location, is safe and supervised during that therapy session in that location? So some of those logistical factors that are barriers, but that are surmountable, that can be problem solved in that environment. Lack of physical contact also came up as a potential barrier. And this is, again, perhaps quite obvious. And a lot of respondents commented on the human connection that occurs from people being physically in the same room with each other. So a barrier that was reported, and how are we going to overcome that barrier with the use of telehealth? And there are ways to do that. Other themes that came out were student factors. So if we have a student who has difficulty maintaining attention to task, how will we ensure that the session isn't disrupted? How will we ensure that they're receiving the just right amount and type of prompts or guidance during this session? And again, this is an ethical consideration. Therapists need to use their clinical reasoning and decide whether this form of service delivery will work for a given student. Privacy concerns were also potential barriers that were mentioned. So how do we remain HIPAA compliant? And as I'm diving further into some of these topics, not just HIPAA compliance, but FERPA compliance, COPA compliance, high-tech compliance. There are all these sorts of privacy issues that come up when we're delivering, having sort of the electronic health record be in this format. Difficulty completing student evaluation. So how do we get hands-on in order to assess body structures and functions, body systems? How do we do that if we're in a more remote fashion? And then some other really interesting perceived barriers came out as well, thinking about issues of access and equity. So economically disadvantaged families perhaps not having internet access, perhaps not having smartphones or computers, tablets to be able to communicate via telehealth or via video conferencing. So again, not insurmountable barriers, but definitely considerations for school districts, for therapists considering implementing this form of service delivery. Overall, approximately 28% of respondents stated that their school districts were likely to adopt the use of telehealth. And interestingly, the majority of respondents here stated that they were not sure or they preferred not to answer. So going back to that stages of change, it sort of gives us some ideas about where folks are in their phases of adoption of this form of technology. But in this study, about 28% of respondents stated that their districts were likely to adopt the use of telehealth in some fashion or the other. Again, the focus today is on participant perceptions of telehealth. However, I do want to just discuss for a bit the use and the importance of telehealth training programs. The importance of telehealth training is cited in the literature, and telehealth is included within the Accreditation Council for Occupational Therapy Education, or the ACOTE standards. As it's written, students must demonstrate an understanding of technology, and telehealth is directly mentioned in this version of the B standards. So it's incorporated into academic programs. But for clinicians, for currently practicing OTs, are there ways that we can provide education on telehealth to promote successful implementation? Within our study, approximately 42% of participants stated that they would be interested in an educational program, educational training on the use of telehealth. And this is an aside from the article. However, this did end up being an included component within my doctoral project And we did end up building some school-based telehealth training modules for practitioners and administrators. And the educational program was designed mindfully to include participants' feedback, to incorporate aspects of the literature, things like highlighting perceived barriers to the use of telehealth, as we mentioned, and ways to address those barriers. Some other telehealth training program components are listed here. Some of these derived from the literature, highlighting perceived barriers and ways to address them, including links to additional resources, borrowing some of those ideas from adult learning theory, an asynchronous delivery format of the educational program, and a remote delivery of the program. So if we're training stakeholders on the use of technology and telehealth, to me, it made some sense to have this program itself be delivered via technology, albeit asynchronous, just to give participants experience in that format. Here's just a brief screenshot of what the pilot educational telehealth training program looked like. And let's move into implications. We covered a lot of ground today. What does all of this mean for the field and the practice of occupational therapy, specifically for those school-based stakeholders? And first of all, and importantly, I think it's vital to involve stakeholders in this process. When I think back to myself as a practicing school-based OT, if someone came in and told me this is the way we're going to deliver services, that would be potentially upsetting to me. So how do we involve from the bottom up practitioners, administrators, therapy supervisors, principals, students themselves, students, parents, and families? How do we involve all these stakeholders in this discussion and mindfully design the use of this technology to be supportive? Additionally, if there are benefits to the use of telehealth and specific therapy situations that might warrant this approach, how are we going to ensure that practitioners have the skill and the mindset to be able to use it? So where does that telehealth training, that educational programming fit in here? An important point to note, and we sometimes get into this all or nothing mode of thinking when considering adopting new technologies. Much of the literature states that telehealth should really supplement, but not necessarily replace traditional service delivery. So what is the balance of how services might be delivered? Would it be best for school district employees, for example, to deliver telehealth services and also carry a brick and mortar caseload? There are also telehealth contract companies out there who hire therapists to provide services in schools via telehealth. Many online charter schools that are virtual may have students with occupational therapy needs. So the bottom line is there are many options for school districts to consider. This is a complex issue. It isn't as simple as turning on a web camera and offering services. We need to consider some of these benefits, some of these barriers. We need to consider privacy components, hardware and software, accessibility, staffing and logistics. So many more questions to ask, lots more that needs to be done as far as collaborations between clinicians, researchers, and school-based stakeholders. Just to reflect for a bit here on the strengths and limitations, again, this was a pilot program. These stakeholders currently did not use telehealth, and I can see that as both a strength and a challenge. We were able to get fresh perspectives from individuals who hadn't had experience with the use of telehealth. We got to get their potentially less biased opinions, but it would be interesting, I think, to compare perspectives from those who have used telehealth and whether those benefits and barriers match up or whether they conflict with each other based on whether the practitioner had used this form of service delivery. This was a multi-year project, so there were some challenges inherent in finding participants to complete the educational program. There was some turnover in staffing between school year to school year. And again, this was a pilot program, so we were able to uncover some issues that can be addressed in future iterations. In summary, telehealth has promising uses as a component of school-based occupational therapy service delivery, and I believe continued partnerships between clinicians, researchers, administrators, and so on will be paramount as we continue to uncover how we can best support students with some of these needs. I want to thank you all so much for your time and attention today. I'd be happy to take any questions about the project.
Daniel, that was fabulous. It brought back memories of you putting together this research project, implementing it. It was pretty spectacular.
Well,
Um,
thank you so
that's,
much.
yeah, it was great. So let me ask some questions. Um, what would be the next step in your research? What would you do next if you had the opportunity to continue this line of research?
Sure. And this is a couple of projects on the horizon right now, but this is definitely one that I want to continue. And I think the natural next step is enhancing the educational program. There's a version of it right now, and I think just updating the literature, updating some of the videos, adding in some more content, and really prepping that to launch another version of this study that would be another pre-post, but in a shorter time frame. So, recruiting local school districts who may be interested in learning more about it, and really doing this again, but in a sort of 2.0 new and improved format of being able to do it within a shorter window of time, more condensed for specific groups of stakeholders. Sort of my next hope.
Great. Thank you. Look forward to seeing that unfold. I unmuted our attendees. And Amit, would you have any questions for Daniel? Your mic is open if you'd like to ask any questions. And while we're waiting to see if there are any questions, Daniel, where can we find funding for telehealth? Say there's someone who's really interested in getting involved in this area, an occupational therapist or another professional. What advice do you give to find some funding in this area?
Sure, that's a great question, and I think we're in a really interesting and important time for that. I think there will be funding, now and in the future, and I think federal grants sometimes are good places to go. So grants.gov, looking specifically, doing a search for telehealth, depending on whether you're an occupational therapist, depending on your field, there may be specific telehealth grants that are available. A lot of these grants are delivered in rural areas, so doing a location-based search. And I was just looking at grants the other day, and I saw the state of Maryland recently offered grants. I think it was up to like 150, $200,000 grants for school-based therapy services delivered via telehealth. So there are sometimes those more unique local opportunities. Um, I haven't really heard of there might be these out there, but I haven't really heard of private telehealth grants or any sort of investment agencies that are offering grants in these areas. So I think your local telehealth resource center is a great place to go with questions. They might have some more specific information, and these are regional. So there would be here in the United States at least a Midwestern telehealth resource center, East Coast, West Coast, and they have a few scattered throughout the United States.
These are great resources. And I was thinking that for an occupational therapy practitioner, the American Occupational Therapy Foundation has grants. And I know that at the very least, there was at least one grant, I think it was Winnie Dunn, who received it looking at telehealth. So I would encourage anybody who's in the field of occupational therapy to look at the American Occupational Therapy Foundation for some funding for grants as well. And Daniel, that would be something I would encourage you to think about doing as well.
Absolutely, that's a great point. I think there might be, depending on perhaps you're in academia, there may be some institution-based grants. Maybe they're smaller, maybe they're bigger. Some institution-based grants that you might be able to look at too. These are things I'm exploring too.
So great. So let's do a little scenario here.
Sure.
Finished your doctoral project, you finished this research project, and you want to promote it to the press. You want to get the message out. What would that sort of headline be, or what would be in this oh release, this message, public announcement to the press that would get them excited about your project and
Sure.
telehealth?
That's a great question, and I'm going to have difficulty being concise and distilling it.
Oh,
Hopefully
that's
there'll
okay.
be
Maybe I'll
some
walk line.
quick writer who can condense it. I'm a creative writer by background, so I like the idea of telling a story. And some of the telehealth case scenarios that we discussed earlier, I think that would be a place to start. Is sort of describing, your problem statement in an academic sense, but in a way that tells a story, in a way that illustrates, the potential problems that could come up and how telehealth might be a solution to some of those problems. So maybe a case study of a student who's received this form of service, a student who would need this form of service, I think would be a nice place to start.
That's great. And I agree. I think the human interest story, the lived experience, is very powerful. Um, so, in reflecting on your project and encouraging other people to investigate in telehealth, what would you say are some of the barriers that people potentially may face in doing such research, and maybe even outside of a school system, looking at adult rehab or adult um, home health? I see tremendous potential with telehealth in home assessment. But what is some barriers that we might face?
Absolutely, that's a great point. Our focus today was that school-based setting, but telehealth is a wide variety of applications and other settings. And I think some of the largest barriers for implementation just center on it being a technological application. Going back to some of that diffusion of innovations theory, individuals are at different, phases of liking technology, wanting to adopt new technology. So I think as much as we can have people have positive interactions with technology, make the platforms, make the interfaces as intuitive, as user friendly as possible, so that we don't have people shutting down halfway into logging on to a telehealth platform. So it's just very intuitive. And there are platforms out there that are really just one click for the provider and for the client, so that it makes it very user friendly, so that once someone has a positive experience, that's likely to sort of echo and can continue a little bit. I think another barrier, and this comes out of the school-based setting for me, but I think it's applicable in other settings. There might be a sense of caution by currently practicing therapists that somehow telehealth may replace their job at their place of employment. If it's more efficient, if it can enhance service delivery, might that be sort of a cautionary tale and something that someone's less willing to adopt? That's actually how I came at this project a couple of years ago. Again, sort of a defensive way of wanting to explore it and see what it was all about. I think as people learn more about telehealth, they'll realize that there's always going to be a place for traditional therapy service delivery, that hands-on component. It might be a blend, it might be a mix, but I don't think there's any denying that there are specific situations where this would be very helpful. Again, there are a lot of provider shortages here in the United States currently, and some of these solutions might be very helpful.
Daniel, that's really wonderful, because as you said, telehealth may not be appropriate for every client that we see, but and there'll always be a place for practitioners to work with clients in the same physical space. But telehealth has enormous, I think, opportunity for providing services. And I'm even wondering about what the future might be. Um, do you want to speculate where telehealth can go, and then we'll conclude the webinar? Maybe your last thoughts are, 5 years from now, what might we see with telehealth, and in particular, occupational therapists have a challenge because we have to be licensed in the state where the client is. So, for example, if you wanted to see a client in California, you would have to be licensed. So I'm sort of looking at the future and saying, can we resolve that challenge?
Absolutely. So thinking about some of those interstate license portability issues that AOTA is working on right now, I think that would be a hopeful component, that we would have that potentially removed as a barrier. Right now, if OTs would want to do that, they would need to explore the licensure laws, policies, and whatever states they're going to practice in. And that would absolutely reduce that barrier. I think when we look to the future, and I'm not the person to come up with this, I've heard this from several therapists who are studying telehealth or using telehealth, is that in the future we probably won't even call it telehealth. It'll just be, another way of delivering occupational therapy services. And my hope for this webinar is that if someone stumbles on it, 5 years from now, it doesn't seem too outdated, but it may just be the case that this form of delivery is just really integrated into what we do as healthcare professionals. I think of the ways that I use email, or the ways that I use different forms of technology, even the telephone, as part of practice. And I sort of see that as a future for telehealth, is it not being this outlier, it sort of being more integrated in the way that we practice. And I think that's another reason that education is important. If we think about the curve of technology and how things are adopted, whether we want it or not, I really think this is something that is going to be happening. So as therapists, we need to know how to use it.
I totally agree. It's what you're suggesting here, looking into the future, really makes total sense. And I look forward to the future of telehealth, whatever it'll be called in the future. And I know that you will be one of the agents of change, a leader in this area for all of us. And I thank you. And I want to thank you for today. Any last thoughts before we conclude today's webinar?
I want to thank you, Karen, for all your support, and thank you to iOS Press and Learn at Work for the experience on being able to present on this important topic today. Thank you very much.
Great, thank you. And everybody who participated, thank you so much. This webinar will appear on our Learn at Work YouTube channel, so you can listen to it again. Thanks, Daniel, and thank you, everyone.
Everyone.